Lemna Ado, me now Dr. Francis Wuri, me now Dr. Fadembele Umandem and the Uman Sikrem. Today we can talk about polycystic ovarian syndrome, and that's something way most women will start about, because I don't get quite a few patients every come in and say, I don't go here, then tell me say I get PCOS. They don't go here and then tell me say I get PCOS. People that we usually we go get PCOS. Mostly obviously reproductive age, because you get for day within the 15 to 49 age bracket, and these are people when they ovulate, meaning how you would think say normally every month one egg will come away, sperm go defend. If the person is sexually active and they look for a pregnancy, you not go get that situation there. You most likely not go they ovulate. You may or may not be having regular periods, but most women they will get this condition and they go months without a period. It will pass 2-3 months, then one come, 2-3 months, one come. The woman they also can tend to forget a lot of male hormones, the testosterone. Now we all get them, all women get testosterone, but not the levels, not the difference between you will not get this condition and you will get this condition. So one of the things that we can look at, you go watch the woman and see say maybe hair go day under in chain. Maybe if you watching belly, you go see say hair they come up from in private part all the way to enable. So then one of the things that we can see. The woman they also get tendency for be obese, like they're overweight. The woman they also we can get this condition. This not a life or death condition per se, but certainly there are risks where I will talk about in a minute. If you don't come to hospital, you get irregular periods, and doctor don't examine you, and they don't send for scan, then see the cystic ovaries, and they don't send you for let you do a fertility hormone profile. We basically go able to tell we how the chemical there inside your body they work. Then your ovaries there, then two things the way they na you pelvis, and then they produce the chemical there so they make you woman. And a fertility hormone go able for check and see how much, what's not the level where you get, where they give you an idea of how you ovaries then they work. We also can do certain tests, because people that we get this condition, they tend their sugar level tend for high. We also want to check your sugar level. We also want to check your cholesterol or your fats inside your body, because I say people that we can get this condition they tend to be overweight. Mind you, not mean to say if you're not overweight, you're not going to get them either. It's just that we talk about the one that we likely forget the condition. So if you get issues with your period, if you think say you don't wanna Google and TikTok else, and you don't think say, oh, this might be something I get, if I know you can hospital, they'll do the necessary examination, they'll do the necessary blood work and ultrasound scan. And if we make a diagnosis, the first thing very important now your lifestyle changes. You're not posting with exercise, yes or no? If you not know, if you begin incorporate exercise. You're not posting with it, watch with you to eat. If it's a no, you therefore watch with you to eat and ensure say you to eat a balanced diet. Lots of fruits, vegetable, reduce all the fry, reduce all the fats and oils. Stand the back, very important. And if we check your sugar, we see that there's an issue, we may put you on a particular medication. For a young girl, one of the most distressing things is the fact that the period need to every month, maybe incontinent period every month. If that's not the case and adjust down that you want, there is a medication we can put you on for ensuring the period every month. But for an older person, we're already for born, the focus is completely different, because at that point now the focus is how do I ensure say I'm able to ovulate and able to get pregnant. Now obviously we don't examine your man as well, don't test your man, see say everything okay, then again there are certain things we will do for see how you can able to get pregnant. So People that will get this condition, minus the fact that they get a higher risk of diabetes in the future, hypertension in the future, something like that, where they get pregnant, there is also a risk of a miscarriage. There is also a risk of a preterm labor, like say the pikin they born before time. There is also a risk of depression, especially when you deal with long-term infertility. So this is not something again where we for deal with in isolation. So in as much as I say not to life death something, it can change the quality of your life if not something where you don't get long term, and especially in a case of infertility or where depression can inside. So if you get any of these concerns and you want to find out if you get this condition, it's absolutely important that you're able for Kana Hospital, we're able for do the necessary checks, and let's get you started on a healthy you. Till next time, Mina Dr. Frances Wuri, they wish you all a happy and a healthy week.